Hello everybody and welcome back to my YouTube channel. I am Dr. Dvipika Garg and today we'll be discussing a little more of image-based questions. I hope the first presentation was clear to all you people. Keep attempting questions, subscribe to the channel, just open up any MCQ thing and keep attempting it so that you know where you stand. Okay. Let me repeat that these questions are purely based on the knowledge which you have gained during your BDS times. We'll be taking up fresh lectures, fresh topics would be covered in forthcoming lectures, right? So all you have to do is attempt these questions so that you know where you stand. Okay, so let's start with it. The first question which we have is identify the highlighted appliance. So here you can see that a removable appliance is given and there's an appliance which is highlighted in black. So you have to identify that appliance. Okay, so whether it is a C-clasp. No, it is not a C-clasp. We all know how a C-clasp is there and it engages into the embrasure area. T-spring. No, it is not a T-spring. The design of T-spring is different. Although it is used in palatal surfaces, palatal regions, it is mainly for buccal displacement of a tooth. Right? Z-spring. Yes, this is a Z-spring because you can see it is in the shape of Z. There are two coils which are present and the coils have to be opened up for activation, right? And then comes the U-clasp. No, this is not a U-clasp. U-clasp, we all know how it covers the area of the tooth and how it is engaged. So the highlighted appliance here is a Z-spring. Next question, identify the appliance. Again, all of you might have seen in your lab that this particular appliance or this instrument is kept. Maybe you have not noticed, but this is a spot welder. Okay, welding and soldering, these are two different terminologies. They both are used in orthodontics and welder is often used to weld a particular thing onto the band. Okay, there can be a buccal tube or any small appliance which has to be welded. It has to be spot welded. Okay, welding has to be done at a particular spot. So for that we need a spot welder. This is a spot welder. Next option which we have is soldering machine. No, this is not a soldering machine. Now we have soldering pens which come. It is in the shape of a pen where we have flame coming from the front region. Next is thermoplastic vacuum machine. What is a thermoplastic vacuum machine and how does it look? We'll be covering it. Autoclave. No, it is not an autoclave. It is not used for sterilization of instruments. We all know how an autoclave looks. So this appliance is a spot welder. Please note, be very thorough with all the figures which are there in the textbook. Next question, identify the appliance. Is it a lip bumper? Lip bumper? No, it is not a lip bumper. Lip bumper is also known as lip plumber. It is used to remove the restrictive forces of the lips which are acting on the tissues. Next, is it an oral screen? Yes, this is an oral screen with a modification. Now oral screen, simple oral screen is one thing and oral screen with modifications, it is a different entity. So this is an oral screen with modifications where holes are given. And once the patient is given this oral screen, phased closure of holes are done. Acrylic is added into the holes so that it is closed in a phased manner as the mouth breathing improves. Activator, no. We have discussed in the previous MCQs, previous image-based question part 1, how an activator and how does a bioreactor look. Next, pendulum appliance. No, this is not a pendulum appliance. Pendulum appliance has an acrylic portion in between with wire components coming out of it. It is used for distalization of molars, premolars, right? So it is basically used for distalization of arch. The figure shown here is of oral screen which is used in mouth breathing habit. Okay, so that is why it is important that you pick up a standard textbook and start going through the diagrams which are given. Okay, if you are a little attentive, then what will happen? When you see the figure in your exam, you will know first thing to which subject it belongs to. If you were a little more thorough in your preparation, you will know which topic it belongs to. And if you are extremely thorough with everything, you have revised everything very well, you have gone through all the MCQs which are shown in, which will be attempting in my YouTube channel. If you have gone through all the lectures, then you will know exactly what it is, what appliance is it, and you don't have to think so much. Okay, so this is an oral screen. Moving on. Again, identify the appliance. All the questions are identification because all of these are image based questions, right? So what do you see here? You see a teenage boy with a component present in the forehead, with a component present in the chin, and elastics. Please note, there are elastics attached from the appliance intraorally. So this is a reverse pull headgear. The one option, that is headgear, is a different thing. The appliance is different. It is used to restrict or modify the growth of maxilla. Okay, and it does not have this chin cup section. Next option is reverse pull headgear. It means its action is opposite to that of headgear. So if headgear is used to restrict the growth of maxilla, reverse pull headgear is used to bring about growth in maxilla. And when do we need to bring about the growth in maxilla? In class 3 cases, where the maxilla can be retruded or the mandible can be excessively ahead. So what is done here is reverse pull headgear is used, where with the help of elastics we bring the maxilla outside, and because of this chin cup structure we restrict the growth of mandible. It is basically modification of growth. Okay, we cannot restrict the growth of mandible. It modifies the growth of mandible in such a manner so that the class 3 appearance is removed. Next is chin cup. In case there is no other assembly which is present, just a chin cup portion is present, then that appliance is known as a chin cup. Frankel appliance, we all have seen in image based questions part 1, how does a Frankel look? Okay, if the lip pads are present in lowers, it is a Frankel 2. If lip pads are present in upper, it is Frankel 3. Please note, wherever the lip pads are there, it means that particular maxilla or that particular mandible, meaning that particular jaw has to be corrected. Okay, so this appliance over here is a reverse pull headgear, where with the help of elastics we'll move the maxilla ahead, and with this chin cup we'll restrict or modify the growth of mandible. Moving on, name the pattern of elastics. Elastics are very commonly used in orthodontics to bring about minor tooth movement. Okay, so now this red color thing which you see here is an elastic. Once you know the pattern of elastic, then you will know what kind of tooth movement it brings about. In this figure, what do you see? That my elastic is running from maxillary canine to mandibular first molar. So when elastic is used in this particular manner, it restricts or brings about a change in the position of maxillary teeth. It will move the maxillary teeth backwards and lead to anchorage loss in lower or forward movement of lower teeth. Okay, so when my elastic is running from upper canine to lower second molar, this is an example of class 2 elastics. Okay, so class 2 pattern of elastics is used in class 2 cases, where we want to move our maxillary teeth behind and bring forward our mandibular teeth to attain a good class 1 molar relationship. In case my elastic would be running from upper molar to lower canine, then that would be a class 3 pattern of elastics. Why? Because that would retrude my mandible and protrude my maxilla. That would bring my maxillary teeth ahead and move my mandibular teeth behind. So that is class 3 pattern of elastics. And the pattern of elastics shown here is that of class 2, which is running from maxillary canine to mandibular molar. Okay, and cross elastics is used to correct crossbite. Next question, which model analysis is depicted? Model analysis you all must have done. A lot of model analysis you all must have done in third and final year. So I'm sure you all know that this is a typical Ponce analysis, where horizontal distance is measured in between the two first premolars from the distal pit, and horizontal distance is measured in between two maxillary first molars from the mesial pit. Okay, Mesial pit and distal pit are the point from where measurements are done in Pond's analysis. If the buccal tip of my premolar is used, the distance between the buccal tip of first premolar from first and second quadrant is used, that becomes my Ashley-Hose analysis. That is a different model analysis. So do not get confused whenever there is a photograph or a picture showing distal pit and mesial pit, it means it is Pond's analysis. Pond's analysis, pit has been taken into consideration. Carey's analysis, we all know how it is done. Moyer's is mixed dentition analysis, and this cast over here is a permanent dentition. Moving on, the next question is, which type of anchorage is seen here? Anchorage, I'm sure all your teachers must have emphasized a lot on anchorage during VDS time. So you all must be very much thorough with it, right? From what is extraoral anchorage to intraoral anchorage, maxillary, mandibular, reciprocal, everything you must be knowing. So reciprocal, everybody must be knowing. It brings about movement in different direction with opposite same force acting onto the tooth surface. For example, if you want to close a case of midline diastema, right? So there would be reciprocal anchorage would be taken to close that space. Indirect anchorage, no, this is not a case of indirect anchorage. During indirect anchorage, what is done? We place this mini screw. What do you see in the figure? That my brackets are attached, wire is running, there is a mini screw, also known as temporary anchorage device, is placed in between second premolar and first molar. Okay, this is an interradicular implant, and there is a hook which is present. Hook is attached to the tad or the mini screw with the help of a coil spring. This is a closed coil spring which is used to bring about tooth movement in such a way that when force is applied, the space present over here is closed. Okay, so if I attach a wire from the implant to the molar and I take anchorage from the molar, then it becomes a case of indirect anchorage, because the molar is actually attached to the mini screw, but we are taking anchorage from molar, so that is a case of indirect anchorage. Here there is no such thing. No wire is running from my mini screw to the molar. Okay, next option, absolute anchorage. Yes, this is an example of absolute anchorage. So how do you remember it? All my mini screws, all my mini plates, all the temporary anchorage devices which are placed or inserted during the orthodontic treatment, they provide absolute anchorage. They are a source of absolute anchorage. Okay, so this figure shown over here is absolute anchorage. Baker's anchorage, we all know, is intermaxillary elastics, right? Moving on, the next question is, identify the pliers shown. Okay, so till now you all must have used hard wire pliers. So these pliers you might not have seen. If you have seen, if you know about them, well and good. In case you have not, so these pliers are wire cutters. They are used to cut wires which are placed into the patient's mouth. The first wire here is a distal end cutter. Okay, when we place the brackets, we insert the wire. Whenever there is excess wire coming out of the molar tube from upper or lower region, that extra wire has to be cut, which is done with the help of a distal end cutter. This is again a wire cutter only, which is used to cut wire, and there is one more which is a ligature cutter which is present. So there are three types of wire cutters which are there in orthodontics. Turret is a different instrument. You all can see what a turret looks like, or maybe I can show you in one of my lectures. Bracket holding pliers is basically a reverse tweezer. Okay, it is used to hold the brackets and place it onto the tooth surface. Bird beak is again a different instruments. Maybe we can take up one lectures which is purely based on identification of instruments. Okay, but for now you remember that if you see these two kind of things, these are wire cutters, right? Moving on. Identify the appliance. Again, one appliance is shown. If you people have gone through the textbooks, you should be easily able to identify that this is a lip bumper. Lip bumper is also known as a lip plumber. So when this acrylic portion is placed here, all the restrictive forces from the lips do not get directed to the dentoalveolar structure. As a result, my maxilla my mandible can move ahead. My teeth can move ahead. There is no restrictive forces acting onto the teeth. So now they are free to move ahead, right? Now, how to rule out each and every option. It is very important that when you get a question, you need to rule out which all the three incorrect options have to be ruled out, right? So the first option which they have here is a lingual arch. Very obviously, as the name suggests, it's a lingual arch, so it has to run on the lingual surfaces of the teeth. And this is running on the labial or the buccal side. Therefore, the first option is cancelled. Next is TPA. What is the full form of TPA? Transpalatal arch. It means it is attached to the palate. This is a mandibular cast which is shown. So this is ruled out again. So now you are left with lip bumper and W arch. If you have seen my previous lecture, you will know what W arch is used for. W arch is used for expansion of maxilla. So this cannot be a W arch. Therefore, this is how you rule out three options. So now you know it is a lip bumper, right? Next question. Identify the type of classification shown. Classification of malocclusion is one topic which you all must be very thorough with, okay? Because it is often asked in your BDS exams. It is confusing at times, but you all must be thorough with it. Simon's classification? No. Leisure's, Dewey's? No. These were two modifications of angles. Okay? Angle classification was given by angles, and then there were many modifications which came to it. So your B and C are modifications of angles. This is a classic figure of Ackermann's and Profit's classification. Ackermann and Profit did a lot of study, and they came up with the dentofacial appearance, okay, which is a broad terminology. From dentofacial appearance, they shorten it down to teeth or the arch form. From that, whether in transverse direction there is a problem, or there is a problem in sagittal direction or vertical direction. So from a large entity, how they are coming to smaller entities to know where the problem lies. So this is what this diagram represents, and this was given by Ackermann and Profit, right? So this is the classification given by Ackermann and Profits. So time and again I am emphasizing on the same thing. Please be very attentive with all the diagrams which are given in the textbook. I'll soon take up a lecture where you know which textbooks have to be referred for orthodontics, which standard reference textbooks have to be taken. Okay, so what you have to do is open those textbooks and just go through all the diagrams which are present. In and out, in your free time, just see the diagrams, look what is given regarding that diagram, so that you can easily attempt all the image-based questions. Okay, the image-based questions which we have done till now are purely from your BDS knowledge. If you could attempt all of this, well and good. In case you couldn't attempt, please make a note of it, because you know that topic has to be read very well by you. Okay, because all of these were very simple and very basic ones. Maybe we can take up one more lecture on image-based questions. So stay tuned for that. I'll come up with one more section of image-based questions which are purely based from your BDS knowledge, and once we are done with that, we can start up with the lectures. Okay, and then based on lectures we'll have some MCQs, and in between I'll be putting up videos on how to prepare, how to distribute your time, and make sure you crack your exams at the very first go and get your favorite branches.